Hello, everyone. My name is Aubrey Schachter. I'm happy to be here today to present my research entitled The Twisted Truth, Decision to Incision Time in Ovarian versus Testicular Torsion. Ovarian torsion and testicular torsion are both surgical emergencies, and delays in treatment of either condition will result in the loss of gonadal function and fertility. Ovarian torsion is more difficult to diagnose at baseline due to anatomic differences and available imaging modalities. And so we aim to describe the length of time between a surgeon's decision to operate emergently on gonadal torsion after diagnosis and the start of the operation, which we termed the decision to incision time. We compared DTI between ovarian torsion and testicular torsion and used this as a measurement of resource mobilization and team efficiency in proceeding to the operating room in emergency surgery. Over a 3-year period, 40 cases of gonadal torsion were identified at a large tertiary referral center in Southeast Louisiana. 21 of these cases were ovarian torsion and 19 were testicular torsion. All cases of ovarian torsion were treated by a gynecologist, and all cases of testicular torsion were treated by a urologist. Decision to incision time was calculated retrospectively based on case posting time and incision time as recorded in the electronic medical record. Variables included patient demographics, time of day, surgeon gender, and surgeon experience level, and a Poisson regression was used for statistical analysis. Overall, we found DTI to be 116 minutes. The median DTI in ovarian torsion was 153 minutes, and in testicular torsion was 80 minutes. We used a cutoff of 90 minutes as an appropriate time for a patient to proceed to the operating room in an emergency surgery. When comparing ovarian and testicular torsion, there is a wide difference, with only 23% of ovarian torsion patients proceeding to the operating room in under 90 minutes, as compared to 73% of patients with testicular torsion. We also saw a similar trend based on BMI, with patients with a BMI greater than 25 proceeding to the operating room in under 90 minutes, only 30% of the time, as compared to patients with a BMI under 25 who proceeded to the operating room in under 90 minutes, 70% of the time. Finally, we noted a trend that ovarian torsion patients were more likely to undergo gonadal tissue excision intraoperatively than testicular torsion patients, undergoing oophorectomy at a rate of 57% as compared to orchiectomy at a rate of 26%. However, this did not meet statistical significance. Overall, we found that patients undergoing emergency surgery for the treatment of ovarian torsion have a delayed decision to incision time that is nearly double as compared to patients with testicular torsion. It is very important to note that this is after diagnosis. And as seen in the timeline above, there are many factors that go into the treatment of gonadal torsion, and diagnosis is one that is tricky for ovarian torsion patients based on factors that are beyond our control. However, from case posting time to incision time, there should be no delay in diagnosis between ovarian torsion as compared to testicular torsion, as these are completely within our control. To find that ovarian torsion patients have a treatment time double that of testicular torsion patients is highly concerning. While we did not find one factor that caused this, we do believe this to be a multifactorial problem involving gender biases against women, differences in surgeon preferences and practices, as well as lack of education regarding the urgency of ovarian torsion compared to testicular torsion among all members of the healthcare team. We look forward to identifying in more detail the specific causes of this delay. However, the first step to improve the outcomes for these women is education. From the emergency room to the operating room, all members of the healthcare team must be educated on the importance of treatment of ovarian torsion as compared to testicular torsion. All of these patients deserve adequate care, and it is unacceptable that ovarian torsion patients have such a significant delay. We hope our research will reach many members of the healthcare team to raise awareness, and we look forward to performing more investigation onto this topic. I'd like to thank all members of my team for their contributions and support, and I'd like to thank you for your attention.